Let's learn about allergic reactions, specifically anaphylaxis. Anaphylaxis is a severe allergic reaction that can be life-threatening. Anaphylaxis occurs when an allergen binds to allergy cells. This interaction triggers those allergy cells to release substances from inside the cells to the body. Those substances can travel all throughout the body to cause the signs and symptoms of an allergic reaction. Now, we're going to go over the possible signs and symptoms of anaphylaxis. Let's do that by body system. A body system is a group of organs that work together to do certain tasks in your body. For example, the respiratory system allows for you to breathe, and the gastrointestinal system allows you to digest your food. So, how do body systems show that anaphylaxis is happening? Let's go system by system so you can understand how each system can be impacted. While we will discuss the signs and symptoms from multiple body systems, keep in mind that you might not see all the body systems reacting during anaphylaxis. For example, you may have skin and GI symptoms, but no respiratory symptoms. Also note that anaphylaxis comes on quickly, with symptoms starting within a few minutes to a couple of hours. It's super important to act quickly the moment you notice any signs and symptoms of anaphylaxis. So now, let's go by body system to learn about those signs and symptoms of anaphylaxis. Did you know your skin is the largest organ of your body? The signs of an allergic reaction in your skin can include swelling and hives. Swelling is most noticeable on the face and head and on the hands. Hives can happen anywhere. They are red, raised, itchy bumps that can cause a lot of discomfort. Your respiratory system is what makes sure you breathe, so it's important to have it working properly. Signs of an allergic reaction in the respiratory system are nasal congestion, wheezing, coughing, rapid, noisy, and/or difficulty breathing, sudden change or loss of one's voice, trouble swallowing, and stridor, which is a high-pitched noise during inhalation, which is when you breathe in. If someone is having respiratory problems, it can mean they're not getting enough oxygen, and this can be life-threatening. The gastrointestinal system consists of the organs that help you digest food. Symptoms of anaphylaxis in the gastrointestinal system include upset stomach, nausea, vomiting, and even sometimes diarrhea. The circulatory system is what moves blood to where it needs to go throughout the body. Signs and symptoms of anaphylaxis in the circulatory system are increased heart rate, decreased blood pressure, and cool, clammy skin. When blood pressure drops, it can cause the brain to not get enough blood, which can be life-threatening. The neurologic system consists of the brain and the nerves in your body. Signs of anaphylaxis can include confusion, agitation, fainting, headache, and loss of consciousness. You've just learned a lot about how your body may react to an allergen. So then, how do you know an allergic reaction is anaphylaxis? Anaphylaxis is when two body systems react to an allergen. A combination may look like lip swelling and vomiting after eating shellfish, or hives and fainting after an ant bite. Someone sneezing around a dog is not anaphylaxis. When you notice two or more body systems, it's anaphylaxis, and anaphylaxis is an emergency. You may have heard that there are multiple definitions of anaphylaxis. Here's a good depiction of that. What you'll see is that two systems are involved when someone is having anaphylaxis. Rest assured that if there's a drop in blood pressure, there will also be other symptoms such as passing out or skin feeling clammy and being pale. Remember, kiddos can't always say exactly what they're feeling, so it is important to notice when they have a change in behavior that could indicate nausea, or when they say something like, "My tongue feels fuzzy," as this could suggest tongue swelling. Anaphylaxis can happen within a few minutes to a few hours. Once you recognize anaphylaxis, it is important to act fast. Even a few seconds can make all the difference in an emergency. All right, you now know what an allergic reaction may look like, including what anaphylaxis may look like. Great job!